As a reminder, this podcast represents the opinions of Dr. Colby Salerno and Dr. Alin and our guests to the show. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions. The views and opinions expressed in the podcast are our own and do not represent that of our employers. And lastly, in no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship. Thank you and enjoy the show. Hi, everyone. Welcome to Season 2, Episode 3 of Both Sides of the Stethoscope. I'm your host, Colby Salerno, with my co-host here, Alin.
Hi, everyone.
Tonight, we're going to be talking about frequently asked questions as well as post-transplant healthy habits. Mostly, we either run into other patients that ask us this, or we see these on message boards, or we get asked these questions through our Instagram. So the first one we're going to tackle that we see, I think, the most out of everything is, do you drink alcohol post-transplant, and or what are your recommendations in regards to alcohol post-transplant? So Alin, I'll let you start us off with this.
Sure. We get asked this all the time. I think there's a few caveats to this question. So the first one being that if alcohol use disorder or alcoholism is what's causing, or it's the etiology of whatever solid organ transplant you need. So for example, if you need a liver transplant from alcohol cirrhosis, or if you need a heart transplant due to alcoholic cardiomyopathy, the answer is absolutely not. If I'm not mistaken, I know our post-liver transplant patients even have to get tested for alcohol use afterwards. So it's generally just to stay away from alcohol. In regards to anybody else who gets a transplant and the etiology has nothing to do with alcohol use disorder, for example, Colby had HOCM, or I had dilated cardiomyopathy from this mutated gene, the answer is still, generally speaking, no. I know when I asked my doctors this early on and I got my transplant, it was basically in moderation is okay. With that being said, in moderation is maybe once or twice a year here and there, a couple sips of it, absolutely not to the point where you're getting drunk. And also, there's a few reasons for that. I'll let Colby talk too, but basically, one of the reasons is because alcohol can actually interfere with your medications that you're taking because they both get metabolized by the liver. And so that's one of the reasons why you shouldn't. And then also, if it caused any sort of impairment, then you might forget your medications. And that's another big no-no. So generally speaking, at least from what I've heard, the answer is no. How about you, Colby?
Yeah, I'm of the same thought. I think the overall answer is no, you really shouldn't drink post-transplant. I think, like Alin said, if it's a liver transplant, my recommendation would be do not pick up alcohol. You have enough to worry about with your liver. The last thing you need to do is add alcohol into the equation. For other solid organ transplants, I think it's really a question of, is it needed? And I think we're always going to find the answer is no. As I've grown up, I think more and more I've realized, there's not much benefit to alcohol in life in general. I think, younger me in college might have thought differently. That was before my transplant, of course. But I think now you just you've gone through something so life-changing. You've been given this gift of life, this new organ, and we really should be doing everything we can to keep it healthy. And the main thing is, of course, there are toxic effects and, health effects that alcohol can cause. But the biggest thing is it can affect your metabolism of your medications. And that's really what we are, where most of the advice from physicians comes from in terms of using alcohol post-transplant, is that it really could mess with the metabolism of these meds, change the levels, which would change, where you should be in terms of a therapeutic range to help you not have any rejection from your heart and or be too immunocompromised that you're at higher risk for infection. So I know myself, I pretty much abstained from alcohol for the most part. When I got engaged, I had one glass of champagne, but I'll go months and months without alcohol. And so I'm of the belief, moderation to me means severe reduction in alcohol intake. So, one drink here and there for a celebration, sure. But other than that, definitely not daily, definitely not to the point of getting drunk. And I have, this is something that is not just me saying, this is something that I do live by myself.
Agree with that. Totally. Another question that we get asked often, kind of along the lines of like whether or not you can drink alcohol or anything else, is always, can you smoke marijuana after heart transplant? What do you think about that, Colby?
Yeah, so I have even stronger feelings about this than I do alcohol, and specifically in terms of smoking marijuana. So I think 100% you should not smoke marijuana. I don't think you should inhale anything that's combustible. So, putting anything on fire or even vaporizing anything. So no cigarettes, no vape, no marijuana. I think it's very important to avoid. And on the flip side, though, people out there, they look towards marijuana in terms of its medicinal properties. People think of it in terms of anti-anxiety. It's been shown to possibly have some benefits in epilepsy. People think of it in terms of pain control. So if you truly feel that marijuana would be beneficial for you, of course, speak with your, own physician. But if you are going to ingest marijuana, my take on it is not to smoke it, but to possibly ingest it through your GI tract. So through edibles, or there's even pills out there these days. And I would probably suggest going that route, again, at the guidance of your own physicians.
I think I totally agree with that. I actually don't know like the literature behind what could happen to you post-transplant if you do smoke marijuana. I didn't get to do a lot of research on that, but generally speaking, just abstain from it is the easiest way to go, or just talk to your doctors if you feel like there's a medicinal need for it, or there's something that you used to use it for before you got a transplant and then you want to continue using it, for example, for pain control or something like that. Then I'd say just go with what your doctor says. Always keep in mind that anything that you're taking extra or new on top of these medications, we do get our Prograph or our medication levels checked every so often, and these things could interfere with the metabolism of that, including marijuana, including alcohol. That's why it's so important to talk to your doctors about whether or not you're taking these medications or drugs afterwards.
And I think, our recommendations, when a lot of stuff in terms of medicine is recommended, it's because a lot of trials have been done to look at its benefit versus risk. And the gold standard in the medical field is randomized controlled trials, where you test the medication in a group of people versus a placebo in another group. And the reason that there's not good recommendations for the use of alcohol or marijuana post-transplant is it's just not a feasible study. You can't have people who have gone through heart transplant and split them into a group of this group drinks and this group doesn't. You would never want to do that. So we have to think about what we know in terms of these things, and the idea of, the toxic features that alcohol can produce, or the changes in your liver that it can change the metabolism of your medications, and kind of just think about that anecdotal evidence and observational evidence and say, hey, you just survived this, life-changing organ transplant, probably not the best idea.
Yeah, that's exactly what I say too. Another thing I get asked often is whether or not you can drink caffeine specifically after a heart transplant. I don't know if your doctor's ever told you whether or not you can, Colby. I know mine basically said you can, but just in moderation. So maybe like half a cup of coffee, if that, every few days is fine. Some physicians are definitely against it, and some are okay with like a little bit of caffeine here and there, because you do have to be careful about increasing your heart rate too quickly when you do have a heart transplant. What do you say to that, Colby?
Yeah, that's a great question. And I think this one, I haven't looked into. And again, this one specifically, please talk to your own physicians, because for me, I can't survive without coffee in the morning. So I need it every morning. And when I work nights, like I could not survive working nights without coffee. I'm a different human when I'm on nights. So I don't drink a ton of it. I don't sit there and chug Red Bulls or anything like that. But coffee itself, I probably do 1 to 2 cups of coffee a day. That's for sure.
Yeah, just remember to ask your doctors about this too, because again, it depends on so many different things, and everybody feels so differently about it.
And it's, I think, important to keep in mind timeframes. So I'm going to be coming up on 10 years after my heart transplant, which is way different than 30 days post-transplant or 3 months post-transplant or 30 years post-transplant. So, for me, my body has gotten used to this new heart. My heart has, realized what medication, what dose of my calcium channel blocker I'm on works for me with my intake. So it's easy for me to say, I drink 1 to 2 cups of coffee and it's not a problem, but for someone else, it could be. Every person is different. We're all individuals. We've all had different transplants. We're all on different levels of medication. So what works for someone might not work for everyone. So this is just general ideas of our thoughts on this.
Exactly. Are there any other questions that people ask us about like dietary habits or like?
Yeah, I get a lot. Do I follow a certain diet, or is there certain things that I try and avoid? And this one is, as a cardiologist, it's like, yes, I preach about heart healthy diet, whether it's the DASH diet or the Mediterranean diet, and that's your fishes and nuts and beans and nice whole food intake from that aspect, avoiding like red meats, your candies, your sweets. So I try and follow that. I definitely am not the best at it. I think if there's one thing I probably would change about my post-transplant life, it's that I would try and do better in terms of my diet. I do a good job of
fellows, like this. You have a good diet when you're in fellowship.
Yeah, but it's hard when full well like what's good and what's bad, and you just still grab Ben and Jerry's and house a pint of Ben and Jerry's. Can't help it sometimes.
I know. No, I agree. I think as far as staying healthy or being healthy, I've never been like too much of an unhealthy eater. Sure, I'll eat, pizza and I'll have like burgers here and there, but I always kind of followed an okay diet, I would say, especially for someone who's like still in medical training. After transplant, I know that especially early on after transplant, I tried to eat foods that had like I tried to eat foods that were like low in sugar, fats, cholesterol, all that stuff. But I think even more importantly, because people are like, are there specific things that you can't eat? And I think we might have talked about this in another episode, but for example, pomegranates and grapefruits and certain herbal teas that interact with your medications, you can't have after transplant. And then the other thing is we kind of follow what I would call kind of a neutropenic diet. So you have to be careful of anything that could put you at risk for infection. And that includes like soft cheeses, deli meats. Again, like I never really ate deli meats even before transplant, so it wasn't that difficult to like take it out of my diet. But yeah, there's specific things that we have to be careful of. Oh, like fresh salads is another one. Or like if you go to buffets, you have to be very careful with the food that you're eating because you don't know how long it's stayed out, and that could put you at a risk of infection. So it's little things like that we have to change about our lifestyle after transplant.
Yeah, I'm the same way in terms of especially raw food. I like if I go to a sushi place, I get the shrimp tempura roll because it's cooked. And, I definitely avoid oysters. Not that oysters was ever part of my diet beforehand, but it's not something that I'm out there, they're trying, when people around me are having it. I have had the occasional deli meat. And again, that's not something I ate right away after transplant, but as my immunosuppression medication requirements decreased, I still would possibly bring like a turkey and cheese sandwich for lunch and
Did you
things of.
cook it or no?
I did not. I
Oh,
do
okay.
not. And I think this is one of the things that in the transplant world would be beneficial. And that's, I haven't spoken, I have not spoke to a transplant nutritionist in 10 years. You speak to them right when you're leaving the hospital and they tell you all about all the foods that you should be avoiding. And I don't even remember anymore. And I think that's, a market, especially as I'm heading into this field of medicine where I'm going to think, maybe we should have refreshers for people because I myself, I'm in this field and I don't recall exactly what I'm supposed to be avoiding and what I'm not since I'm so far out, which is a blessing and a curse in a way.
That's so funny because I said exactly the same thing recently, and I actually found our dietitian who was like in the IC. I happen to be in the CTIC right now, like as a physician, but if I ever get hospitalized, it's also where I am. And so I found her, and I was like, I really need your help. I forgot what I can eat and can't eat. And she gave me like a list of stuff. And then the other thing that we have to be careful of is like foods that are high in potassium, or at least I do. I mean, everybody's a little bit different, but because Prograf, which is one of the medications that we take, increases your potassium sometimes. So you have to be careful of like potassium rich foods. And so she had to like print out a list of like things that I could versus can't eat. And then she always like gives me refreshers every time I see her. So it's really helpful having that at work. But if I didn't have her, I don't know what I would do.
And this is something that's just coming to me as we're sitting here speaking about this that I didn't prep for this episode. But part of me wonders, is there a difference too? And, in terms of the importance of follow-up with dietitians, I think, we see our doctors, we get our testing to keep looking for rejection and try and avoid coronary artery vasculopathy. But now that I'm so far out, is it okay that I've had a turkey sandwich or am I doing myself harm? And I don't know. And I think that's where it'd be great. Maybe any dietitians out there who would like to come on this podcast, I think maybe there's
That
possible
would be great.
we could have a whole episode about this. And I think, again, this is not something that's just about heart transplant. This is all organ transplant, all people who have an immunocompromised illnesses. So cancer patients who are on immunosuppressive chemotherapy and patients with autoimmune diseases who are on immunosuppressants. I'm sure there's a difference in terms of what to avoid and what to eat and how far out you are. And so I think that's something we should definitely look into in the future.
Absolutely. I think, yeah, we should definitely have like someone on the show, but also it'd be great to be able to follow up with someone like in clinic. I don't know if any of your clinics do that out there, where when you go to, see your doctor once in a while after you're so many years out, they also have you meet with the nutritionist or dietitian who helps you out with these things. Like that would be amazing.
Yeah. Any listeners out there, if you at your center, if you have like yearly or even like every 5 years, you follow up again with a nutritionist or dietitian, let us know. You can, send us a message through our social media. We'd love to hear if different centers across the country are doing this differently.
In general, my dad also says this, and I don't know how much like nutrition training you got in med school, but I think I got like maybe like 1 hour lecture on it once at some point. But it's just good to know all these like nutrition recommendations.
Yeah, and shout out to our dietitians. This is not the trajectory this episode. We were headed in, and here we are.
Okay, what's another question that we get asked often?
Yeah, so changing direction now, completely kind of from that theme of question, is would we be willing to accept a high risk organ? And for the most part, when people ask this, it seems to be in terms of patients who are positive with hepatitis C. Would we be willing to accept an organ from a hep C positive patient?
I would say absolutely. Even when I was asked this right before, when I was waiting for my transplant, I said I would definitely accept a high risk organ if that's what it came down to, just because, I mean, it's hard to pick and choose when you are desperately in need of an organ transplant. And the thing is, like, for example, with hepatitis C, that can be treated afterwards. So I know that sometimes we do high risk donations where I work, and we just treat the patients afterwards, the recipients afterwards, with whatever medication that they need to get rid of whatever virus it was. Most of the time it's hepatitis C. So yeah, for me personally, I would definitely say yes. That's not something that everybody agrees with, but I think that there's a shortage of organs, and there's only so much that we can pick and choose when it comes to these organ transplants.
Yeah, I definitely would say yes in terms of a hepatitis C positive patient. The medical advancements that they've had in the treatment for hepatitis C is incredible, and it's pretty much curable. So the medications that you take now for hep C can cure you. So it's pretty simple. You get the organ, you see if you're positive. If you are, you treat it, and you're good to go. And you're now happy and healthy with a new heart. Quickly treat the hep C and get to move on with your life instead of being stuck there waiting for an organ. And I think this was on the news. I'm pretty sure there was a physician who is a transplant surgeon who I believe took a hepatitis C positive organ in proof of, to show everyone that it is very low risk option.
Yeah, that's actually Dr. Montgomery. He's very open about it. He's over at NYU, and there's articles about him everywhere. If you guys just look up Robert Montgomery, he ended up taking this hep C positive organ transplant and got treated for it, and is now doing very well. He actually got his transplant just like a few months before me. And so, and he's great. He advocates for it all the time.
Another question I see that's very specific to heart transplant is, was I on any mechanical support? So did I have a balloon pump or an Impella? Or was I offered an LVAD, and would I accept an LVAD prior to transplant? And this question for me is very difficult to answer. So I never had to have a balloon pump or an Impella, which are two devices that can go in through your artery up into your heart and help support your heart when it's failing. Then there's the LVAD, which is surgically implanted. It's a big open heart surgery, the same way transplant is, where you'd have to get a pump. But that one you can go home with and wait on the transplant list from home. So I remember when I was waiting for my heart, my doctors mentioned that an LVAD would not be a good option for me. And I think it had to do with the cavity size of my left ventricle. And I don't think it would have been very beneficial. So it wasn't even on the table. But a friend of mine who I met in the hospital was very sick, and he needed an LVAD. And he ended up, though, not being able to go home because he was so sick, and he ended up getting moved to another floor right below me. And we both sat there waiting for transplant. And I know that he didn't really have an option. So he was so sick, he was going to die without the LVAD to bridge him to transplant. So he got the LVAD, and he did really well, and he's doing really well. And I think it's really tough for people to understand that they'd have to go through pretty much back-to-back open heart surgeries first to get the LVAD in place and then the transplant. For me, being in this field now, I can see in terms of how life-saving it is. But I do know as a patient, it would be a lot for me to have to take mentally to know that I had to go through 2 open heart surgeries. One is enough for most people to take on the mental aspect of having to prepare yourself for 2, I think is very difficult on people. And I don't think it should be downplayed at all. But I do know that LVADs are just getting better and better in terms of their technology. And if you are sick enough to need one, your doctor is probably recommending it for the right reason. So that's kind of my take on that.
Yeah, I think I would have to agree with you. So it's hard people ask me that too all the time. Again, I like when I work in the CTICU and I see heart failure patients who ask me what I would do. I never had to get some sort of mechanical support, but I do, we take care of patients who are on all sorts of mechanical support. That includes LVAD, RVAD, ECMO, Impella, balloon pump. There's so many different things that patients could get right before a transplant as a bridge to transplant. And personally, I think if it came down to it and it was life or death and I needed to get some sort of mechanical support, I would absolutely say yes. But again, it's hard for me to talk about that if I haven't necessarily been in that situation. I ended up getting a heart transplant when I was put on the list. I ended up getting it so quickly, luckily. So, I didn't have to think about these decisions. But if it came down to it, these things are all life-saving. They do have their cons. So, for example, when you get any sort of mechanical support, you have to be put on anticoagulation, which kind of thins out the blood. And so that puts you at risk for things like head bleeds, or, and then if you don't get the correct amount of anticoagulation, you might even be at risk for clots. So there's different pros and cons to these therapies, but ultimately, like, you kind of have to weigh the risks and benefits as to what's going on with you. So if you think that you would rather have that risk of getting the LVAD and having the risks with an LVAD as a bridge to transplant, then it's all for you. And in general, when doctors do recommend it, then, it's because they're recommending it, and it's hard to choose for you. So you should make that decision yourself.
Agreed. And I think one part of practicing medicine as someone who's been through so much medically that didn't really register with me until recently is my ability to recommend things that I've been through is inherently influenced by having gone through it myself. And so most physicians, right, they haven't had a balloon pump, an Impella, an LVAD, or a transplant. And so they recommend them across the board the same way they would to everyone. But now that I've had a Swan catheter in and a heart transplant, it's like I know what those things are like, and I can speak to them more personally with a patient. And so when I have that personal experience, it makes me more likely, I think, to gravitate towards maybe that type of intervention. And having not been through something, it's harder for me to try and conceptualize it when I see patients going through it, because then that's where the experience comes from, having watched other people go through it. And it's a definite inherent bias. And I, now being aware of it, is actually making me better in terms of how I approach things. But I think initially I was always thinking like, oh, why not just transplant? And it's like,
yeah,
because I did so well and you're doing so well. And, there's stuff like that. But it's like, now that I'm aware of it, I definitely think it actually makes me a better doctor, because I'm stepping back and thinking, hey, just because this went well for you, it's like you have to look at the big picture of what is the best for that person.
For that person. Exactly. That's exactly what I say. I think that's all that we have for today as far as questions go. If you guys have any questions for us, again, feel free to email us at bothsidesofthestethoscope@gmail.com, or feel free to follow us at both sides of the stethoscope. Oh my God.
It's so hard.
You have to leave that one in. Feel free to follow us at both sides of the stethoscope on both Instagram or Twitter. We love hearing from you guys, so please do so.
Yeah, everyone, thank you so much for listening. We will be back again in about 2 weeks. And in the meantime, please subscribe to our podcast either on Apple or Spotify or wherever you do your podcast listening. See you soon.
And we're done.